Ladies and gentlemen, thank you very much for gathering. Japan Legacy event, first day. Thank you very much for participating. I would like to serve as the MC for today. I'm from NCGG, Peninsula Oshima. Please stay with us to the very end.
Yes, it's just 2 minutes. Okay, so you want me to? Okay. Okay, I will start. Right. This is
Next, and back.
yeah, okay. Hi.
声かけてください。声をかけて。
Well, maybe in a few, 1 or 2 minutes. Okay. It's a misunderstanding. I thought it was tomorrow.
Oh, okay. Either way, we've now got it.
Yeah. This is Gada Fachit. いつでもどうぞ。
ただいまよりセッション4、認知症に
Now we would like to start session 4, New Care and Prevention Models. So we would like to start this session, and the chairperson is from Tokyo Dementia Care Research and Training Center, Japan, Professor Honma Akira. And also from Alzheimer's Disease International, we have Executive Director, Professor Mark Wortman. So I would like to hand it over to the two chairpersons. Thank you. Now we would like to go into the second session of the afternoon, and this is the last for the day. So without further, I would like to start. It's about education, enlightenment, and this is an issue, whether it be prevention or treatment. These are some of the basic foundations. And so we have no argument about whether training and education is important or not. We have 8 speakers today, and from each perspective, we would like to hear from them. And together with me, we have the co-chair, Mark. From ADI perspective, he will make comments, and I will make some comments as well. One person has 10 minutes for his or her presentation. Please make sure that you honor the time. And this session will close at 5. We have to finish by 5, they say. So we ask you for your cooperation in being punctual with the time. Without further ado, I would like to pass it over to the first speaker, which is the Secretariat from Alzheimer's Disease International, Professor Mark Wortman.
It's a pleasure to be here and a pleasure to share with you, Professor Honma, who is a member of the Medical and Scientific Advisory Panel of ADI for many, many years. I just want to say a few words what ADI is. It is an umbrella organization of all the Alzheimer's associations worldwide. So it includes Alzheimer's Japan and associations from the other 7 countries in the G7 or the G8 even. There are over 80 member associations around the world. And why are we here today? I think it's good always to keep that in mind, because dementia is a global problem, and it's a growing problem. You may have heard the numbers already these days. 44 million people living with dementia in the year 2013, maybe 45 or 46 million now today, and it's going up to almost double by 2030 and again by 2050, unless we find a cure or something to prevent or delay the onset of the disease. And our joint effort is to make sure that this curve is not going to happen, but it bends down. Another thing to keep in mind is that the majority of people with dementia live in lower and middle income countries. That's already the case now, and it will be more in the future. And in the previous session here, we had some presentation from China, and China is getting a real big burden, but also Japan with its very old population. And if you want to know more about ADI, you can find us on the website and all the social media. Now it's my pleasure to introduce the first speaker to you, which is Jill Ayling from the Department of Health in the United Kingdom, who has been very supportive in setting up all these events and making dementia a real priority from the UK government. So I'm glad that you can be the first speaker for today. And she will talk about enhancing awareness and education in society.
Konnichiwa. Hello. It's my pleasure to be here today. My presentation, I'm going to give you a little bit of flavour around UK and our dementia policy, but primarily what we're doing to improve education and awareness, and what practical tips and models we've been using so that I can share that with you, because my philosophy is copy, copy, copy. Okay, so I'm sure you're all aware of these figures. I think dementia is a global issue that none of us can afford to ignore. There are 44 million people globally with a $604 billion price tag attached to it. In the UK, it's estimated there are 800,000 people who have dementia, and that number is going to double in the next 30 years. We did a survey of people in the UK, and over 55 said dementia is feared, is the most feared illness over cancer and heart disease. So we know this is an issue that is starting to prey on people's minds as they are getting older. The other thing that we have within the UK, and I'm sure it's the same globally, is that people caring for people with dementia is really important. If that carer goes into crisis, then the person with dementia goes into crisis. So we need to be supporting the carer. And I think sometimes we forget about the carer. And then across the UK, there's huge variations in services. Again, I'm sure it's the same globally. So what's been our journey? So I was privileged to be the start in 2009, and I helped draft with other colleagues the National Dementia Strategy. So it's in my bones. I'm passionate about dementia, and I've stayed in this area, in this field, because of that. And then we had the Prime Minister's Challenge in 2012, and our slogan behind it was to go further and faster. How can we do more around improving diagnosis, raising awareness and understanding, and research? That then culminated with our Prime Minister using the G8 presidency for the UK to have the first ever Dementia Summit, which was fantastic. And our main ambition is to get a cure or disease-modifying therapy. But I suppose for me, the most important is the cure is coming tomorrow. We have to think about care today. We have to think about how we're supporting those 44 million people who've already got dementia. And how do we do that? Through civil society, through you and me. How do we, as society, raise the profile and awareness of dementia and reduce that stigma? So as a consequence, I was asked to head up the Global Action Against Dementia programme. So as you can see, all the slogans behind. So it's fantastic for me to come to Japan and see the third event. So we've had one in London, we've had one in Ottawa, and this is the third. We really need to champion and pioneer and innovate in order to defeat dementia. And not just in our own countries, and not just across the G7, but to low middle income developing countries, because as we've seen from other reports and research, that it's those countries that are starting to see the prevalence increasing. So for me, importance of education is key. I think whilst we're waiting for the cure, we need to think about how we use education to reduce the stigma, to increase awareness, but most importantly, improve care and outcomes. So some of the things that we're doing within the UK around education is we're starting to use the curriculum for health and care workers so that they get dementia training and dementia awareness. So when they're in hospitals and they have people with dementia in hospitals, they know how to manage them and how to support them. As we know, people in hospital who've got dementia are in there for 3 times longer. So we need to ensure that those professionals who are looking after them are educated and aware of what to do. And it's the same in care homes. So again, we've heard with previous presentations of where we know people in care homes through dementia care and support can actually change. And I think it was Dawn Brooker, where are you, Dawn? Who talked about the interventions that you can make, and you can see the difference with that individual by actually helping to support them and working with them. So I noticed this morning the Japanese Times. How many of you seen this today on page 3? Can I ask? Have you seen this? So the thing that stuck out to me the most was this quote about 115 dementia patients died in train accidents in the 8 years ending in 2012, and some of the victims' families were forced to pay damages to the railroad operators. Now that is a terrible thing. You know, people are wandering with dementia, and instead of supporting them within the communities and understanding it, we're saying it's their fault. We're placing a stigma on those families and those people with dementia. And when we've done the study and the surveys, people tell us, I'm afraid to tell others that I have dementia because I'm not sure that my friends and my family will be patient towards me or will help and support me. So we need to find ways of reducing that stigma and raising that awareness. And if we don't, then we won't be able to support people to live well with dementia. And I think this picture highlights the importance of that, of people being lonely and isolated in their homes and in care homes, but we want to move it to a place where people feel engaged and alive. You know, they may have dementia, you and I may get dementia, but I've still had a career, I've still had a family, and I still want people to respect me and still have a life. So these are some of the practical things we've been doing in the UK. We've got the Dementia Friends campaign. And this is my badge. And I came to Japan 3 years ago, and I copied the caravan mates, and we took it back to the UK, and we just used it. Now Canada are doing the same, and I would really like to encourage other countries to do it. So we now have over 500,000. We also have dementia-friendly communities working with businesses and organisations. Then people are going into shops and businesses that their staff are trained to support people. We also have health checks. So when people go in for their regular health checks, that they're starting to be educated around what's good for your heart is good for your head. Again, all around prevention and early intervention. I funded a House of Memories, and this is a museum in Liverpool, and they use memorabilia of people's memories, you know, back in the 40s, 50s, and 60s to stimulate those memories and they're called, they have like luggage, and they take them into care homes and they take them into hospitals and people's own homes, and they use them to start to stimulate discussions. You know, how many of us hear a song on the radio and it takes you right back to where you were when you were in your early 20s, you know? So we all know that memories are important. And we're also, as I said, using training to also improve awareness. So for me, I think some of the models that we need to harness, and I love this picture, this is about using people power, using dementia friends and society to, I've seen my minute, thank you, to ensure that we allow people to still remain within their communities, to live well, to go into shops and for people to be patient with them. The power of the crowd, dementia-friendly communities. How are we all supporting one another through partner organisations, businesses, third sector, charities and citizens? Again, talking about partnerships. So integration, working across health and social care, supporting one another, working with organisations like ADI, Alzheimer's Society, research organisations and charities. Governments need to look at those. I met a lady last night at the ADI event who talked about art as being a therapy. And she said, it's amazing how people feel empowered by using art and finding a new skill. And I don't think we invest in those different types of interventions as much as we should. And then I love this. So I suppose only people from UK will know this, but there was a book called Millie Molly Mandy when I was younger. And at the front, there was a map of her village. And this reminds me of that. And it shows you through universal advocacy of everybody working together and raising awareness, using education and supporting one another, then we can have better dementia-friendly communities that enable people to live well with dementia. Thank you very much for listening.
Thanks very much, Jill, and thanks for your passion for the cause. There's room for one or two questions. Yeah, at the very back. If you say your name.
Hi, yes. Hi, Howard Bergman from McGill University, Montreal.
Hi, Howard.
Just, what is a dementia checkup? You said when people
Yes.
go to their GP, they can ask for a dementia checkup. What do you mean
So
by
in
that?
the UK, there are different levels. So the level for people who potentially might have vascular issues are like 64 to 74. So as they go for a checkup once a year into their GP, they're spoken to about the risk factors of stroke and cardiovascular, and are highlighted that could lead to vascular dementia. So there are things that we can do to prevent vascular dementia through a healthy lifestyle, through eating. So they're giving that advice so that we're trying to get an earlier intervention into those people from that age group.
Yeah, and from a certain age, I think it's 55, you get an annual request for a checkup as an individual in the UK. That's maybe not in every country. Any other question? If none, then thank you very much. Oh, question over there? Graham Stokes.
No, just Twitch.
Okay. Thanks very much, Jill. And we know you have to leave for the embassy for official things, but stay with us as long as you can. Thanks. So it's, and again, a pleasure to introduce a good friend, Sabine Janssen, who is the Executive Director of Alzheimer's Germany. And she is in the dementia community for a long time. And she will be talking about Out of the Shadows, campaigning and educating, and that's something they're very good at in Germany.
Thank you very much, Mark, for inviting me and the Japanese people. And I would try to give my best. You gave some. When I talk about campaigning and educating in Germany, I do this from the view of a family caregivers organization. The German Alzheimer Association is working now nearly 25 years. And when we started our work, there was a lack of information everywhere. There were no booklets, no information brochures, nothing. And when we started, we focused on caregivers themselves to give them information and strategies how to cope with the disease. And if we look now, we can see that we have the theme of dementia and Alzheimer's in cinemas, we have it in theaters, we have it in books. But if we ask people, we still have a stigma, and if people phone our helpline, sometimes they still say, if you send information material to me, please send it in a neutral envelope. We don't want to be seen that we get information materials from the Alzheimer Association, and that's still very bad. So if we look now, we have many more target groups. When we started with the caregivers, and if you see the list now, we have also people with dementia themselves, because diagnostic has gone forward and people are diagnosed in a much earlier stadium of the disease, and we can address themselves. We have the healthcare professionals, and it was already mentioned that especially healthcare professionals, for instance, in hospitals, where you think they should be should have knowledge about every diseases, then we can see that if people with dementia come to hospital, for instance, with a broken leg, they are really they are cured the leg, but they don't know anything about dementia. And so we should address our educational program also to healthcare professionals. But we have also other groups. It was already mentioned in some speeches before that children and young people can be such a group. I will go to it later on. And also other groups like policemen, fire workers, people who work in the municipalities. And also the general public should be informed to make life more safe for people with dementia. If we look to all these different groups, it's obvious that you need different materials and also different methods, and that you have different aims to reach the different groups. So if you, for instance, focus people with dementia themselves, and you want them to give their voice themselves, and then you have to empower them, and you have to bring information material to them which is maybe in a more easy language and with more pictures and understandable for them. And you should find another language than if you address, for instance, healthcare professionals. So our philosophy is to use many ways, because you have, even in the healthcare sectors, you have people who like to read books, and but you also have people who like to see films, and our philosophy is to use as much methods and materials as possible. And so we just started to work a special program for caregivers on an e-learning basis, so to reach, for instance, caregivers who live in more rural areas or that are not able to attend training courses. We have a lot of training courses, especially for caregivers with dementia, and they are also financed by our long-term care insurance. But if we ask people, why didn't you go, they say, it's too far away, the opening hours doesn't fit our needs, we can't leave our person with dementia, we can't leave him alone. And so we try now to go to more electronic ways, but I think also this ways is not fitting for everybody. We also start a special course now, and we are involved in a research program for young onset dementia. We heard about it by Florence earlier this day. And even because this number of people is so small, we only have a very small number of support groups, for instance, in Germany. And so also in this field, we start in a research program first to look for the needs, and then to start a e-learning program for this special caregivers, because they have other problems than caregivers, for instance, in higher age, because they have children in the households, and they need to earn money. They are not retired yet, and so the problems are quite different, and you have to find the program which covers their needs. Also, we need volunteers. I think in most of the G7 countries, there's a lack of professionals. Especially the care profession is not very attractive. You can't earn so much money, and it's difficult to find young people to come to this profession. And so we need volunteers in addition to the healthcare professionals. And concerning the volunteers, we are in competition with other NGOs, for instance, and other teams that also look for volunteers. And so you need attractive, advanced training for these groups. And so you see, you need a wide range of different materials and methods. And this photo, for instance, shows a poster on the street in Gütersloh. Probably we don't know because it's a very small city in Germany. And our national conference 2 weeks ago took place in Gütersloh. And our local branch used this event with more than 700 participants, and they put posters all over in the city. Coming to two special projects which were funded by the German Ministry for Family, Senior Citizens, Women and Youth. That's the project Alzheimer and You, and we addressed young people, pupils in the age of 14 to 21. And first of all, to attract them, we started a competition for young people, and we told them to go into action with people with dementia and their caregivers, and then send us written or documents to tell about this activities. And out of this project, we developed education materials for teachers, and we have an interactive website. Here it's www.alzheimerandyou.de, where you find education material for teachers, but more or less you find films for young people, you find good examples how you can engage as a volunteer, and also you find support if you are involved with Alzheimer's disease because your grandparents, for instance, are have the disease, or maybe even their parents if they are still, for instance, with frontotemporal dementia. The other project is also funded by the same ministry. We called it education of people in the municipalities, because people with dementia, they live everywhere. They live in our municipalities, and they still go in shops to sell things. They go to bank accounts. This is a situation in a bank. Or they are lost, and they are firemen or policemen come in the situation to find somebody which is lost. And all of these people, they don't have much knowledge about the disease, and we develop very short education programs with short information about the disease, how to communicate with the people, and the third is how or where to find help in this special community. And we evaluated this program, and then we put these films to the programs to make it more realistic for them. The last campaign I like to show is a campaign, Greetings from the Sea. Obviously, you see we worked with disorientation. People see it and they get irritated, and then you can inform them about disorientation by people with dementia. And this is a very good example to campaign together with partners, because campaigning is quite expensive, and this campaign didn't cost anything for us because we managed to find a PR agency who worked for us for free. They got a prize, and they worked in a theme they like to work, so there was no customer and forced them to do it in a special way. So it was a win-win situation for everybody, and this was really successful, and they still show a TV spot also for free, because they managed to find TV agencies to send the film for free too. So that's our slogan from World Alzheimer's Day this year: dementia, everybody can do something, and you don't have to focus only on the healthcare professionals here, and you only have to educate them, but maybe you can also focus on the neighbor. We need the neighbor, and we need the bus driver, and maybe also the Alzheimer's dog, but that's another story. Thank you very much.
Thank you very much, Sabine. I think an inspiring talk. Are there any questions? No, I think it was crystal clear. Interesting to see the disorientation campaign that also run in the Netherlands with different photos, but the same idea. Now the third speaker is again a good friend and someone who works for ADI part of his time and very well known in the dementia community. Mike Splain is going to talk about awareness, why we need dementia-friendly families and communities. The floor is yours, Mike.
Thank you. Konnichiwa, and that's about as much as I've learned. Except last night I got my name written out in phonetic characters, and I'm so excited to take that home. I have an 8-year-old granddaughter who will also be excited that Grandpa has his name written out in Japanese. I want to thank Dr. Endo for all the communication that got me here, got me settled and oriented and squared away. And I also, for the first time, got to meet the leader of the Alzheimer's Association of Japan for many, many years. Takami-san is what he told me to call him. I think that's probably proper. But I was delighted to meet him and learn more about what's going on. I want to talk about why. Why is and maybe we should have gone in different order, but I want to talk about why we need dementia-friendly communities. And while I was flashing back on some very surprising music that Jill would not wonder what was between my ears when she asked that question, I was also thinking, why do we need dementia-friendly communities? And I got to tell you, I think I'm beginning to believe that dementia is a moral test. It is a moral test at the family level. It is a moral test at the community level. It is a moral test at the global level. How we deal with persons with dementia in all those levels is a test of who we really are and who we can really be when confronted with the scary unknown, when confronted by the unsolvable through traditional medical means, when confronted by the vast numbers of people who are becoming persons with dementia before our very eyes. And do we have an ethos? Do we have a culture, an ethical culture that is supportive of persons with Alzheimer's disease, that promotes their rights, that accepts them as they are? Do we have that in place? And I think not yet, but boy, I see it coming as quickly as possible because people are buying into, at least the dementia community is buying into the need for a dementia-friendly society. I'm reminded of when I was a boy. Yes, it was a long time ago, but I can still remember. When I was a boy, if I did something wrong in my town, my parents, because we had an ethos in our community, my parents knew before I got home that I had done something wrong in front of another adult. And I see many of you smiling thinking about that. I don't smile about it because I got wailed on because I was wailed on. Let me try that for the translator. I got disciplined severely. Better? Okay. When my parents would find out something like that. We had an ethos in the community of all the kids of the community were all of our responsibility. Are we going to get there with dementia? Well, I put my disclosures on because I have a lot of different clients and we don't need to go through this. But let me just say, what's driving the dementia movement today more than anything else from a campaigning and messaging point of view? We have the most complicated set of messages about dementia, made worse by conversations like we just had in the other room, by our own internal bickering. But let me simplify it for you. It used to be easy. For the first 25 years of Alzheimer's associations and Alzheimer's associations at the local level, we had a focus on people with Alzheimer's disease in the middle and later stages of the disease. That's when people got diagnosed. That's when things were so bad that they finally went and sought medical help. And this, though, however, to this day, the image, the public image, and therefore the public policymaker image of Alzheimer's disease is at the far right-hand side of the scale. That is only the middle and later stages of the disease. It is only a disease of old people. It is only a disease of people that are likely to be a public cost because they need long-term care. This is the continuing, persistent image of Alzheimer's disease. But look, we're changing. The biggest change in the last 5 to 7 years, is already noted by Sabine, but others, is that we have more people although not many more people. We have more people who are getting diagnosed in the early stages of the disease. We are no longer what I would have called us before, the Alzheimer Caregivers and Related Professionals and Scientists Association. We are the persons with Alzheimer's disease and caregivers and all others. We now have, in classic public health terms, we now have the opportunity of the person affected by the problem being able to articulate solutions and, in fact, demand solutions of us as Alzheimer's associations as well as our broader society. Big change. We also are in an era where, because of rapidly advancing science, we believe we can do some detection of the changes in our brains even before people have cognitive and functional symptoms. And way out here on the far left, we're also entering an era of being able to talk about modifiable risk in Alzheimer's disease. We can't do much about the unmodifiable risks, right? You can't go back and pick your parents. Some of us might have wanted to. We can't go back and pick our parents and grandparents that make up our genes. We also can't do an awful lot about the fact that we all want to age. Well, some of us want to age. Some of us are still in denial. But in fact, the modifiable risk factors. And so we have a very complex message to deliver, and particularly when you think that when we intervene across this path, we have the opportunity to affect an awful lot of lives with our messaging. I mean, in fact, if you look at the far left, if we could do effective messaging about risk reduction, we can do an awful lot more for a lot more people than we can do about messaging about the high-quality end-of-life care that people may need. Thank you. I was going by the timer, but we're about on the same page. It's good, and it's in a number I can read. So we have we're now in an era where we're just beginning to understand ourselves that Alzheimer's disease and dementia is a life course disease, and we have the most complicated campaigning messaging situation possible. So, and Alzheimer's is different than other diseases. What's different? I want to highlight that families still are the people who take care of people with Alzheimer's disease at home for most of the length of the disease. That we have a disgusting, we have an immoral, we have in my opinion, a gross medical negligence situation because we have this amazing gap, a malpractice gap between the number of people, the estimated number of people, the prevalence of Alzheimer's disease, and the number of people that actually get the knowable diagnostic steps. We have also companion with Alzheimer's disease, people with a lot of comorbid chronic diseases, and we're all suffering from siloed budgets and systems. This all leads to findings in every major national plan, most of the subnational government plans, that Alzheimer's disease sufferers and their families suffer from stigma, from nihilism, with this potent, horrible mix of ageism plus a lack of capacity, a lack of imagination to deal with Alzheimer's disease as a life course. It's a setup for misery. It's what makes Alzheimer's different. This is why, in many ways, the ultimate, if you will, the ultimate campaign so far that we've seen executed has been people that have campaigned for their countries to develop national government Alzheimer plans, to get Alzheimer's disease out of just the aging box, but also getting it recognized as a health and a public health issue. That every national plan and almost all the subnational plans have said we need to increase awareness and take proactive steps to reduce stigma. We need to implement, to the level of the evidence available, ways in which we can make the lives of people with Alzheimer's disease better, and our processes need to include persons with Alzheimer's disease. I've had a long run in working with people with Alzheimer's disease. I started in 1986. It's kind of amazing to think about it. We're still dealing with some of the same problems. But the thing that I'm most proud of in the last few years is that our processes, including government plan processes, have included the voice, the direct voice of people with Alzheimer's disease, as has our campaigning. And last, another goal for national plans has been around not necessarily new spending, but better spending. So, we can talk later about the domains, but there are growing understanding of what there are 5 or 6 domains of dementia friendliness, and Mark's going to talk more about that tomorrow. Hint, hint, go listen to Mark tomorrow about dementia-friendly communities. But I really wanted to focus on the why. Why are we doing this? I think I've experienced in my own life that, in fact, Alzheimer's disease and dementia is a test. It's a test of all of our metal, not metal, not metal like banging metal, but our metal, that good English word that means our grit, our courage, our capacity to extend ourselves in ways that we could never imagine ourselves being extended. I have an amazing gift in my life of an extra family. 42 years ago, I got dragged home by Pauline, who was one of 5 sisters. And we have been through, with 5 sisters, we have been through the journey of Alzheimer's disease with my extra mom, Evelyn Bergreen. And I got to tell you, I never believed and I never understood being tested in so many different ways and still trying to come out on the other end as moral people and as good to each other as we possibly could be. It's an incredible test, and we're facing it at the family level, the community level, at the societal and global level. Thank you. Oh, and you automatically killed the slides. Thank you.
Thank you, Mike. Any questions or comments? Somebody who completely disagrees with the moral test? No? Okay, we can keep you.
I'm going to start singing the song that Jill put in my head, maybe. Reach out in the darkness.
So our next speaker, it's a pleasure to introduce from Thailand, Mrs. Tasani Tantiritisak. You have the longest names in the world, I think.
Yes, I guess.
And you're going to talk about care and prevention of dementia in Thailand.
Okay.
Thank you.
Thank you. Konnichiwa. Good afternoon, ladies and gentlemen. Thank you for the organizing committee for inviting me to this excellent meeting, especially Dr. Endo for his kindly communication with me. Today I would like to discuss about care and prevention of dementia in Thailand. Now Thailand is going to the aging population due to the big great birth rate in the mid-19th century. On our national survey in 2010, we found that the aging people more than 60 years old may be nearly 13%. And we expected that in 2020, the aging people may reach to the 20% of the total population. By the good prevalence rate of the dementia is about 6 to 7% of the people who age more than 60. So in Thailand, we estimate that we will have over 500,000 demented people in our country. We have the 2 organizations of care. One is the government section. Most of the government hospitals are under Ministry of Public Health, and the others, some are University Hospital under the Ministry of Education, and the others are under other authorities. Also, the private section which take care about the 30% of our medical service in Thailand. We also have 3 major funds. One is the welfare for civil servants, and the second one is the social security. The third one is the universal corporate, which have the budget from the national budget for the people that did not under the other funds. For the flow of treatment, when the patient complain with the cognitive impairment, they have to go to see the primary doctor for the initial diagnosis and management. Then the primary doctor will refer the patient to the subspecialty. We have the 3 subspecialties that involve in the treatment of dementia. One is the gerontologist, the second one is the neurologist and psychiatrist for treating the psychiatric symptoms. We work together for the holistic care for the patient. Most of the specialists were working in the tertiary hospital or the university hospital. We also have the association involving in the dementia. One is the Dementia Association of Thailand, which provide the academic issue for the treatment of dementia. The second one is the Alzheimer and related disorder association, provide information or educated for the caregiver and home health care. The third one is the Foundation of Alzheimer's Disease. This association may major in the research area in psychiatry, in the dementia. And the fourth one is the Gerontology and Geriatric Medicine Association, provide academic issue for the gerontologist. For the awareness activity, we have many awareness activity, especially the World Alzheimer Day event. We set many hospital or association will set the event on September each year. We also have the short movie competition about the Alzheimer disease the Alzheimer patient stories. And we have many kinds of education, such as talk in TV, sport, newsletter, and events such as World Alzheimer Month and website from the alzheimerthai.org or timememorytest.com. We also training for the medical personnel for the specialized in dementia, especially the nurse and the general practitioners, also the caregiver. And we have the Healthy Elderly Cup in every rural area of Thailand that make the elderly people to have the active social activities. For the prevention projects, we have many kinds such as the Use the Bend or Lose It. We encourage the elderly people to have the active social activity or hiring the retired person still to work, or encourage that you have to still to work, not live at home. And this is the second project, is the Old People Pay Young, we call OPPY. This project make the elderly people go to school again to learn about how to use the computers, telephone, digital camera, and how to communicate with other people with the social media such as Line, Facebook, or Twitter. The third one is the active social engagement. This is for the special person that still work well, or they will prolong their retirement period later. And the Healthy Aging Cup that I described before. The final one is the cognitive training programs. This program is setting by the Ramatipdi Hospital, is the research project. They will screen the elderly people for the MCI in 5 rural areas in northern and eastern part of Thailand. And they will give the MCI patient for the cognitive stimulation program, and let them do at home under the supervision of caregiver or nurses. This project is still ongoing. This is the example of the World Alzheimer Days event this year. You see there are many hospital or association that will set up the event for awareness of dementia in September. This is our example of my institute. This year we set the event in the park where the people go to exercise. We screening for the risk factor of dementia, such as the blood pressure, BMI measurement, and blood test, and also do the cognitive screening. We also have the many booths for stimulate brain exercise, such as the making a craft or playing games and healthy food demonstration. And we also have a small talk about how to prevent dementia or how to take care of the patient at home. About the treatment, we have our own clinical practice guidelines that we work together with our subspecialty that involved in caring dementia people by using the evidence-based medicine data. And we also have the memory clinic. This is the multidisciplinary approach, and we include the doctor, nurse, physicist, occupational therapist, social worker to work together for caring the patients. And we also have the group meeting for the caregiver. Every time they come to the clinic for education and the counseling too. About the drug, due to the high cost of the drug, especially the cholinesterase inhibitor or the other drug, only 50% of Thai patients that can access the drug. So many people just receive the symptomatic treatment. We also have the daycare unit to take care of the patient who did not have the carer in the daytime. And this patient will join the activities such as the exercise, dancing, writing, making a craft. In some patients who have the disability, we send them to go to the physical therapy and have the treatment with the alternative traditional Thai massage too. Finally, I would like to thank you, Dr. Sirinthorn Chantasarikan. She is the president of Thai Alzheimer's Association for helping me, giving me some information about this presentation. Thank you.
Thank you for your interesting presentation. I have a question. I was triggered by this older people play young. I really like it as a concept. Are there many people taking part of that? Is it easy to convince elderly?
Just only in the big city.
It's only in Bangkok?
Yes.
Yeah, okay. Any questions from the floor?
What was the meaning of the map?
The
Different
map.
colors.
Different color. Oh, it's just the flag. The flag color. We have the five color.
Five
It's
colors in the flag, and the country is very
in the
long,
flag.
you know. Okay, thank you very
Thank
much.
you.
And give our regards to Mrs. Srinatong.
We would like to change the chairperson. I'm in charge of the MC. Now we have 4 more speakers coming up. 4 more professors to talk about the Japanese status and how we are making efforts in this field. The first speaker in the latter half of this session will be provided by Professor Kunio Nita. It's a primary care physician, and he is one of the representative athletes in this field, we should say. From Medical Corporation Tsukushi-kai, he will give us a lecture. Thank you very much, Professor Homa. I'm going to speak in Japanese. You can all rest assured. In the second session, we had discussions regarding prevention and care. And we were saying that community is very important for care. And now I'm talking about enlightenment of citizens in that direction. So in terms of dementia patients, we're actually pursuing the ideal city, ideal society, a dementia-friendly society. And in order to solve this problem, we need to focus on the problem of dementia itself. And also, we need to think about some of the barriers in society, the societal barriers like insurance systems that become a barrier for a good quality life. And also the family or the people that surround the dementia patients are also one of the elements in terms of environment that surrounds the patient. And I would like to think about each and every piece. So the first one is prevention, medical prevention, and the countermeasures, the medical countermeasures. In Japan, we often say, we talk about the second point, which is the redemption of the medical insurance services. Now, we do have a certain extent of progress in this field, providing medical redemption from insurance system, but there are still some barriers. And some of the elements that prevent that are the lack of self-help and also help from the community or public support. When we again think about the dementia patients, they have not only neurological impairment, but also problems in their life or their physical status, and furthermore, social, psychological elements as well. So this is where it relates not only the patient, but also for the community. We actually use this diagram to explain to the community. Now, sometimes there's a vicious cycle, the degenerative sort of a cycle where the family deteriorates in terms of physical activation or physical and mental status. And with this, it limits the patient from participating in social activities. In order to bring this from a negative circle to a positive cycle, we need to think about the three elements that I spoke of earlier: the social factor, environmental factor, and of course the personal factor of the patient who has dementia. By focusing on these elements, and if we can turn it into a positive circle, we believe that even if dementia progresses to a mid-stage or the final stage, they can still adapt to society with, of course, the understanding of society. In terms of environment, it means an environment that the patient is familiar with or feels comfortable in. This is the sort of environment that will help the patient to continue to adapt till the very end. Michael talked about dignity and ethics earlier, so I would like to talk about that as well. I think the one thing that protects the patient is self-support, autonomy in their daily life. And the other autonomy is independence. So that means you need to have independence in your daily life and also autonomy that allows you to express yourselves in your life, even if you have dementia. I mentioned the 11 items, but I think movement is one, so that the patient can be active in the society freely, then eat, and also excretion. These are some of the elements that maintains the patient's dignity. Even if you have dementia, we can still maintain dignity by nailing these basics. It is not to say that they lack dignity or have no personality or they're just empty-headed or things like that. That is not to be the misunderstanding that we can accept. By not allowing these negative elements to impact the patient, we can help the patient live more comfortably. Let me introduce where we are. We're in Kunitachi City, which is a bit outside of Tokyo. We have 74,000 people, the population. And among that, we have 21% of people over 65 and 10% of people over 75. In this situation, we have defined the number of people who need some sort of nursing care. The number, as of 2014 spring, is 2,994. Taking out the patients with dementia, we have approximately 1,000. And if among that, we have 288 people who live alone and 58 who live in a solitary situation. This map is showing the location of these patients with dementia. In our Kunitachi city, we actually have something called Careway. It's a care approach to patients with dementia. First of all, they're healthy, then they become MCI, then they go to primary, middle, advanced stage. In these stages, we try to define what is necessary. What do we need to provide to the patients at Kunitachi City? And so, when you're healthy, first of all, you need to make friends. You need to have a society. You need to participate in citizens' workshop. We provide these workshops twice a month, and eat is another important activity. A home doctor oversees such activities, making sure that the patient is doing these activities. And also, there's a model that the Ministry of Health, Labor, and Education has established. We have this day, a dementia day, Alzheimer Day. And 3 years ago, we started this, or actually 4 years ago, we started this cafe for people with dementia. So we're focusing on the solitary people who live in Kunitachi City, the 50-something people who live alone. They need support from the family, and also they need to be able to adapt to change. They need actual supplies, physical supplies. from the municipality as well. So what do we need to do? What should we provide? The first thing we did was create a care team for dementia. And also, we have a supervisor. And we need to beef up the system of care team for dementia to fight the disease. And also, with the government and the citizens and the medical caregivers together, we try to build a society together from our roles that each of us have. We continue to do this as we speak today. There's another topic that I'd like to introduce. In our Kunitachi city, I'm going to use the word of wandering. There's actually 13 people who walk around on their own and basically get lost wandering. I will use this word intentionally. And there are types here. There are people who lose their way, there's delirium, and there's other reasons. What they are doing is, well, they were going to get breakfast, going to get exercise, or just going shopping or going to the post office. But the thing is, they could not go home. What can we do to address these people? Well, we can use the wandering GPS system and also have a network together with the police boxes, and also provide cars too, including taxi companies. This is how the city as a whole oversees patients. Ultimately, we're thinking that this is a city that should be a place where patients can live even when they end up being solitary at the end. That is the sort of city that we are trying to build. Thank you very much for your attention. Thank you very much. That was a very tangible speech. Thank you very much. It was very specific. It would be wonderful if we can create such a city, because it would become a place for patients to feel reassured in. Any comments or questions here?
Thank you for your presentation. It may be that Japan is a very safe society, but I'm thinking of issues around crime. For example, in some English cities, would be very difficult to protect people who were vulnerable to crime. And I wonder whether you might address that.
Last year, in Kunitachi City, we actually had only 2 thefts and 1 murder. It's a very safe city, is my comment. Anything else?
This morning about a lady who wanted to go out and wander the streets because she felt imprisoned in her own home, and eventually her daughter allowed her to do that. And like Dawn, I thought, well, how safe is that to do? But it's great to see how safe it is. So the story of the lady, and it's about respecting the person with dementia and respecting what they want to do. Do you agree?
Exactly. I certainly do. Thank you. Are we good with questions and comments? Thank you very much, Professor Nitta. Proceeding, we would like to move on to the next speaker.
The next speaker is Dr. Noriko Saito. In Japan, we have the Japanese Nursing Association. This is the largest association for nurses. About 1.5 million nurses? Well, no. 580,000 members, but still it's very big. 680,000 nurses are in the association. This is a big organization. Nurses are very close to people with dementia. And what kind of thinking behind nursing is something she is going to present toward the achievement of the dementia friendly society. Dr. Homa, thank you very much for the kind introduction, and thank you very much for giving me such a precious opportunity. I am the executive officer of Japanese Nursing Association. My name is Noriko Saito. As was introduced, our association consists of 680,000 members. This is the largest association in Japan, including the other industries. Well, people with dementia should live lively, and I'd like to explain to you what we are doing for their life. What is the society we have to aim at? There are a lot of expressions depending on the country. What we say is it's very important that there are least burdens on the patients and their families, and people with dementia can receive continuous medical, nursing, long-term care services with high-quality services, and they can continue to live. And also there is no bias and prejudice and against dementia, and people with dementia's wishes and rights should be respected. The public and healthcare professionals and the government should collaborate for realizing dementia-friendly society. That means people with dementia should be supported so that they can live comfortably. And that is the society we have to create. And for that purpose, we have many different roles, including nurses. We have medical specialists and nursing specialists. And of course, we support to enhance QOL of those people with dementia. And also governments should be focused on establishing good cities, and also institutionalization, and also informal support by the public is important, and participation, involvement. And we have to protect the right of people with dementia. That is very important as well. So including nurses, we have nursing and rehabilitation and medical experts, and they should focus on the lives of people with dementia, and how to support those people should be shared as our goals. That is crucial. That is indicated on this slide. Our association has these missions so that we can support the society where patients with dementia and families can continuously live in their own town to the last minutes of their lives while maintaining a human dignity. First of all, our theme for this session is education and training, so I'd like to focus on this theme as well. But other than that, our association is involved in publicity, public relations. What nurses can do for people with dementia is conveyed as messages. And also in Japan, we have a lot of nursing opportunities, and we listen to those nurses, and so that we can reflect what we hear in the actual practice. But today I'd like to only focus on education and training. We have training sessions and education in the Japanese Nursing Association. First of all, we need a thorough education and training systems about dementia. Right now, 1.5 million nurses are working in hospitals and nursing care homes and clinics everywhere in Japan. And 1.5 million nurses. Do all of them know about dementia? Are they all experts? Not really. Well, in the training session about nurses, dementia was included only about 26 years ago, in 1980 or so. So it was very recent. So there are some nurses who haven't really learned about dementia. in their basic training to be certified as nurses. So we have to provide foundation for their knowledge of dementia. So we provide basic knowledge, and also understanding and looking after patients are included in the training, and also collaboration should be included in their training sessions for practitioners. Since we have 1.5 million members, we cannot really have meetings for all of them. They cannot come to Tokyo. So we have on-demand distribution of information. Even though they're home or they're working, they can be provided with such information. And from this year, we started managerial training sessions, how to establish care systems and how to support families, and how to establish support systems and the management of the operations, and also collaboration systems, how to create that. Managerial staff members learn all of them. Totally about 25,000 trainees we have, and they deepen understanding. Also, they have good outcome about understanding challenges. And another one is training of professionals. Those are core personnel or people to be trainers and instructors. In 1995, we started this initiative, and as for dementia, from 2006, we started this training session for professionals. As you can see, more than half a year, we have training courses, and we have about 8 sites for training. The number is increasing every year. And also we have postgraduate education that includes 26 units, 33 institutions in Japan. For postgraduate education, they are specialists of elderly care. We still have a fewer number of people, 66 members, to undergo this training. But for certified nurse training, we have 480 members trained. And in 10 years or so, we are going to have 3,000 members who underwent this training. The outcome is very significant. Expansion of the living functions and BPSD alleviation, and also community care. Staff members are trained through these programs. And also, we train community people as well. That is supported by those people who underwent the trainings. And for postgraduate education programs, we have 6-month program, and we have the same sort of outcome. Another one characteristic is ethical coordination. Elderly people have onset of dementia and how they would like to live to the end, and also conflict with family members. And that should be coordinated ethically. And that is part of the activities. And also there are some difficult cases, but by intervention of those people, we can coordinate with all relevant staff members. And also researches on care are done here too. Japanese nurses and nursing staff. One out of 17 working women are nurse in Japan. So we should have power. We should empower those nurses, and we would like to exert further effort. Thank you very much. Thank you very much. Any questions or comments?
質問。よろしいでしょうか。
No questions? Okay. The role of nurses is very, very important. It's crucial and essential for dementia care. If no additional question?
Well, that 1 out of 17 working women are nurse. Yeah, that's amazing. Yeah.
ありがとうございました。はい、
Thank you very much.
いただきます。次もですね、看護師さんからの発表ということに。
The following speaker I would like to introduce. She is focusing on building the society, building a city, and she actually has some case practices that she is active in. Convenience stores and other stores. How much do they understand patients with dementia? And you know, the level of that knowledge and how they address the patients is tightly related to how comfortable the patients are. So from Tokyo Dementia Care Research and Training Center, she is my colleague. I would like to introduce Professor Nagata, Kumiko Nagata, Ms. Kumiko Nagata, on the multi-layered human resource system supporting people living with dementia. Thank you very much, Professor Endo. Oh no, Professor Homa. How could I make a mistake with this name? I'm sorry. Thank you very much, Professor Homa. Thank you very much for providing me this opportunity. I'm sure that all of you are quite tired, so please relax, you know, unwind as you listen to my presentation. Earlier, from Michael, Dr. Spillane, we heard about the ethics, and I would like to talk about that. It's actually on my first slide. When we have a patient with dementia, there's a lot of repercussions that spread throughout the family and other people that surrounds the patients. But the repercussions used to be painful, troublesome, and very negative in the past. But today, it has to change. Because if there is someone who has dementia, it has to create some other waves to the people who surround the patients. It's an opportunity for us. It's a beautiful virtuous cycle or a nice wave that expands among people being tested of how they should be as human beings and how they can address the patient. I would like to talk about how the dementia care has developed in Japan and the current status as well, and the future, of course. Taking care of dementia patients and training people who supports the patients, the situation has changed dramatically in the past decades. We started from year 2000 focusing on personal care, individual care. And so the Ministry of Health, Labor, and Welfare in Japan started to take actions to establish the training centers for dementia caregivers, especially by municipalities. Municipalities by prefectures chose leaders to nurture going forward. So there was a continuous training of these people from 2000. And from 2005, we also tried to shed our focus on people who live in the community, which we call dementia supporters. These are not necessarily professional caregivers, but they are supporters. And also, we actually started to establish a system for support doctors and also a training for your personal doctor. And from 2010, we tried to promote support in the community. It's called the Dementia Regional Support. And the promoters have been trained after 2010. Also related to Ms. Saito's activity taken by the Japanese Nursing Association and other organizations and societies have been very active in promoting these training-related activities. And with the development in such manner, we've been able to establish a variety of jobs or occupations related to caregiving for dementia patients. And so step by step and steadily, we have been able to increase the number of caregivers in various sectors. But now we have some challenges, too. First of all, the quantitative challenge is that we have more people with dementia prevalence, more than the number of people who we were able to train. And the people who are trained sometimes leave. Another problem is that various types of organizations train the people. So it's very hard to keep track of how many people have been trained. the municipalities don't have an idea of how many people there are that can give care in their prefecture. The qualitative issue is that the share of sense of values is not being promoted. Also, there's a big gap between learning and exercising. Another point is that there are various new fields of knowledge and experience. And so the new knowledge needs to be provided as training to the people, but there is not much opportunity to continuously provide education to people about the latest knowledge. Therefore, we need to further expand our activities to train people, but there is a gap between municipalities. In Japan, we have about 1,700 locations, municipalities, but there's a big gap between the municipalities. Some have various beautiful landscapes, some have a very nice fisheries town, and so it's not like you have dementia and you're supposed to get the same care from every single municipalities. Unfortunately, that is not the case. Each municipality is working on their own pace, but there needs to be something that binds them all. So, of course, the municipalities have to work on their own way of establishing training and care for dementia patients, but we need to unify it in an integrated manner across the country. This is another challenge that we are seeing. So, in order to address these challenges, we know from our past experience that we need to grow human resources who can think but also exercise what they have learned and provide that with unity to each municipalities. And also, we've been focusing very much on professional care providers, but we need to also train the government officers as well, because they need to be capable of planning the society, planning initiatives for dementia patients. Furthermore, we need to build a network among these people. We need to share experiences, share best practices in a unified, comprehensive manner. And to do that, we need to have a very comprehensive and unified system across the country. So this is one of the thoughts that we have as we practice our activities as Tokyo Dementia Care Research and Training Center. Going forward, we would like to be close, be right beside the people with dementia so that they can continue to live with comfort in the community. And we need to provide a system where the dementia supporter can work together with care professionals and also nurture leaders within the municipalities. Also officials within the municipalities that can put together a plan with a mid to long-term perspective. Again, also to address the gap between municipalities, we need to have a prefectural officer that can monitor the multiple number of municipalities in their prefecture to get some unity in their progress. With this all integrated together, we would like to have a nationwide initiative, which we, the Tokyo Dementia Research and Training Center, is leading to help develop officials in municipalities and also promote training for leaders, collecting best practices and sharing it with cities and towns. So this is how we are trying to train people from not far away, but from a place that is close to them in the beginning. Currently, we have local government officers getting together in one room to share their plans and their best practices. And then when they leave the meeting room, they would go back to their municipalities to talk to their people, promote more activity, and train leaders or put together plans for training. And with that, they actually get the stakeholders involved, the supporters and professionals together in one room. I'm sorry that the photos are small, but this is the citizens, doctors, and nurses all together in one room. Various other professionals, too, mixed and mingled in one room to look at the real people who are in their municipalities and how they can work to support them and how they can sort of pursue new challenges or try new ways to support them so that they can be involved in the earlier stages, all the way to the middle and advanced stages. As dementia unfortunately prevails in the city, these are some of the practices, the best practices that support them well throughout the journey. Now, it's not just about supporting them. These are opportunities for hope. They give hope for these people. You can maintain yourself. You can still be you yourself, even if you have a progressing dementia. It actually gives a very rewarding job for the care supporters. I did mention that some of them leave, and that is a challenge, but we need to provide a system where they can be rewarded, visibly rewarded, through their jobs. So this is sort of the virtuous cycle that I am talking about. And the challenge is, how can we expand this throughout the nation with uniformity? We have made various trials and errors, but to summarize my presentation, I'd like to mention 3 points. First of all, we need to understand that even if you prevail with dementia, you can thoroughly share the values and objectives in their community to support them. We also need to give a rewarding job to the future candidates for supporters by showing them how the training has been provided and what kind of rewarding jobs that they've found. The third point is that we need to build a human resource pool, including patients with dementia. The patients can also become lecturers in a seminar. And so this can be a first-hand knowledge sharing among the stakeholders that are directly related to this challenge. This kind of activity is expanding within the society, and we are at a phase to try to expand this and strengthen these initiatives going forward. This is how we believe that training is a very long-term journey. It's not like you can train a person just in one day. Stigma is also a very thick wall, but we need to continue to work together as a collective group to fight against these thick walls. And there are various other challenges that we are facing, but we would like to continue to pursue the possibilities by sharing knowledge with the globe. Thank you very much for your attention. Do we have questions, comments from the floor? Yes.
Vladimir Hachinsky, London, Canada. I was intrigued by the concept of senior leaders. Who are they, and how are they selected?
Yes. The case that I introduced this time, the word senior leader, is chosen in each prefecture of Japan. They have been selected in each prefecture. They go through a very long-term training at our center, and they would go back to their prefecture. Then they would be responsible for training more trainers in the community. These are people who have nursing experience in facilities or have experience in taking care of people in home. That is one of the criteria to choosing these prefectural leaders. They come to our training center, we train them, and then they go back to their prefecture and become the leader of the on-the-ground sort of education.
Provincial officer, in your case, in Canada. Can I ask a question? I wonder, you said it's not good if the care is not the same all over the country. And that's a discussion in many countries where care often is decentralized to the local level, to the municipalities. And then you get some differences. And I agree that it's not good if the level of quality is low. But there are also some positive things. If people have more autonomy in their work, that can be more satisfactory. They can be innovative, and then others can learn from it. What do you think about that?
Exactly, you are right. I completely agree to what you mentioned. So we do have this unified system of training everyone in a very unified manner in the center. But the purpose of that is not to provide a cookie-cutter solution to every single prefecture. We also teach the conceptual level, how to think about your unique problems, how to grasp the needs that arise in your prefecture. If you have a group of people who are skewed to maybe more advanced in your community, then how should you better address them? So we're thinking more about how uniquely you can provide support to your community, and it's about training the people who can address that. And I actually think that the gap between the municipalities are interesting because there is no two municipalities that are the same. And the sense of values seems to be very different as well. The needs to the level of how much support they want is different depending on whether you are a very large-scale metropolitan municipality or a small town. So sometimes in Japan, there's this word that it's too long for too long to put on your arm, but too short for your arm towel, but too long for your waist towel. So it means that we cannot give a cookie cutter solution, because if we try to fit one size fits all kind of solution, then it would be too short for some municipality and too long for some municipality. So it's really how to address the uniqueness.
ありがとうございます。他に
Thank you. Any other questions or comments from the floor? Thank you very much, Ms. Nagata.
では最後にですね、このセッション
I would like to introduce the very last speaker for today's session. One of the hosts for this summit is National Center for Geriatrics and Gerontology, NCGG. From NCGG, we have Professor Endo Hidetoshi. He is one of the leading actors in this effort.
and the training in
The theme is training in the future of enhanced awareness and education in Japan. I was thinking that I was going to speak in English, but I'd like to speak Japanese. From this year, I am the director of the National Center for Geriatrics and Gerontology, Center of Training and Innovation for Gerontology. I'd like to devote myself for training and education. Well, maybe in 10 years, I'm going to have dementia. And when it happens, I'd like to have good nurses for me and good doctors, good caregivers for me. So local area and the communities, how to foster good human resources is something I'd like to do for the rest of my life. That's why I'm here today. We talk about government or local governments, communities. In Japan, we have bureaucratic health policymakers. They are strong, and as written in here in 1984, training for case staff members in Japan for dementia was initiated. And around this time, dementia became a social issue. And right now, in each Asian country is facing this situation around this time. And in 2000, when the long-term care insurance was implemented in Japan, we were in collaboration with the government to have discussions about how to address dementia. I have been a medical doctor for 32 years, and dementia is the core for me. Nursing care and also treatment for dementia should be initiated from Japan. That was my dream. And the epoch-making event was this long-term care insurance that covers dementia, day services, and nursing homes. And because of this insurance, we have more fulfilled systems and facilities. Another epoch-making event was that a lot of researchers talked about reducing stigma But there are a lot of different types of stigma depending on the country. It should be different. About 30 years ago, when I became a doctor, there was a confinement or prison at home. Like people with dementia are confined in a room at home so that they don't wander. They are locked in. And when I saw that situation, I really wanted to address that issue. That was the start of my activities. So the national government started trainings, and in 2004, on Christmas Eve, the 24th of December, there was this change of terminology from dementia to Ninchi-sho, that means neurocognitive disorder. In DSM-5, they are trying to have this new term. And in Japan, the government initiative changed the term from dementia to neurocognitive disorder. That was really significant. And after that, there was the 10 years campaign started in 2005. Dr. Honma proposed training of doctors, and that led to this dementia support doctors approach. And in our national center, in these 8 years, we have these dementia supporters. We train those supporters every year. We have lecturers who are community leaders, who are doctors in the community, and those people train the other doctors. That was a system that was initiated around this time. 26 years ago, there was no education of nurses that was presented before, and it was the same for doctors. We didn't have any training for doctors regarding dementia. There was only 1 page of description of dementia when I was trained to be qualified as a doctor. But right now, we have only 2,000 specialists. We have 4.5 million patients, but we have lack of number of doctors. So primary care doctors have to care those people with dementia. So we had to increase the doctors, specialists, and to eliminate stigma, we trained specialists. And I said 4.6 million, but according to the Ministry of Health, Labor and Welfare, it's 5.5 million. So my data is obsolete. So we have done doctors' trainings and senior leader approach, trainings for senior leaders, for caregivers, and multi-layered approach. That means a lot of different layers of specialists should be trained for dementia. And in Japan, we have covered a wide scope of occupations, but it was not large enough. But in terms of training and education, we are starting to be developed. And the Ministry of Health has initiatives for access to medical support. Medical Center of Dementia was established because of that. Recently, the trend is the Orange Plan. From 2012, we have a 5-year plan by the Ministry of Health, Labor and Welfare that includes educational systems. So I have only 3 minutes left. I don't know what to do. And this is the objective of the training and education. One thing is to stop the stigma and also to enhance awareness of the public. And the next one is to reduce a care burden of the families. If you don't have this, everyone goes to the facilities. They have to go to the facilities and institutions for community care. Family, to support families is very important, crucial. Family support to reduce BPSD should be crucial too. And for that, we have care staff education and specialist education is very important, and that is called multi-layered approach. In the future, through education, we need to enlighten the public that leads to early stage diagnosis that leads to radical treatment of Alzheimer's diseases and MCI. We can start early to eradicate, to have radical treatment. And multi-layered approach was mentioned by Jill, so I'd like to skip this part. But there are many multi-layered approaches, public, families, and classroom type trainings and professional trainings. Recently, shopkeepers training, policeman training, and student training in the earlier stage of education. And these are the tools. Well, lectures are the major tools, but we can use DVDs. Recently, for professional trainings, we use group works a lot because through case control, we have to conduct group work to make it more effective and to reduce the stigma, to enlighten the public. The biggest contribution came from TV programs from 2003. I have been featured by TV programs, and tomorrow Dr. Matsunaga is going to be the moderator for the sessions. But to enlighten the public was my focus. And books are important, but we have less people who read recently books. So e-learning maybe, and movies, videos. This is really important. Every year we have movies related to dementia. Every Day is Alzheimer's is one of the movies, and I am one of the actors, actually. I have performed. So please check this movie. And the internet, nichishouforum.com is introduced in the booth. Recently, we have English videos as well. So please check it out. NCGG information is provided on this website. Q&As are included here too. This is the framework. The government initiates, and also we foster leaders under the cooperation of the Japan Medical Association. This was what we have done in these 8 years. And through the Medical Association, neurologists and also psychiatrists, about 2,000 people became specialists of dementia. And we'd like to expand this to the public. Doctors are not invited only to give lectures. We have consultation systems for GPs. And also they can become leaders for community network. And also in the local areas, they can be consulted by local governments. And they are leaders in the communities as well. And also they have early initial phase intensive support team. And they are the leaders and members. So we have focused on multi-layered training. And going forward, collaboration and cooperation is the focus. Well, since I'm running out of time, I'd like to skip this, but the target is doctor, professionals, persons with dementia. We have to foster good leaders, especially for persons with dementia. We need to hear voices of those people so that we can make policies. In Australia, they are doing it. They have a reflection of patients' voices on the policies. And also education is a very important element for that too. And Dementia Cafe, in Japan, we have an increasing number of those cafes. It's a comfortable place for them to hang around. And I really hope that these kind of places is going to increase. Last but not least, and these are future aspects. Of course, we need to reduce stigma, and also improvements of the care. Quality of care should be enhanced. Accordingly, nursing staffs and doctors should provide good care to reduce PTSD. Starting from fundamental and basic training, we have to have more advanced trainings for those staff members as well. And we need to understand the importance of good practice, and also sharing information among different countries is important, because Japan cannot be advanced only by ourselves. We need to share education and information with the UK and the United States too. And the worldwide support system is necessary. In our center next year, we are going to have an accommodation model for people from all over the world to be trained. Especially WHO is going to be the center of the activity, and developing countries and Asian countries will be invited for improving BPSD and the care quality of care. Thank you very much.
ありがとうございました。
Thank you very much. Any questions or comments?
Yes, please. The mic is coming.
Maybe I like to add one comment to your last point, the worldwide support system. I missed in my speech, and I just want to mention the twinning program of ADI. I think that's one step, because we twinned with Turkey. We have a lot of Turkish people in our country, and we cannot find the proper way to educate them, because it's another culture and other kind to get information. On the other side, we have a lot of German retired people living in Turkey because of the weather is better than in Germany. And now we started an exchange model, and I think that's what we need, so that we go to the Turkey to teach or inform the retired persons there, and somebody from the Turkish association is coming to Germany to teach us how to communicate with the Turkish community in Germany. So that's maybe one example for this worldwide exchange.
Thank you for your comment. I want to go to Germany and Turkey, okay?
ありがとうございます。他に
Thank you very much. Any other comments or questions?
よろしいでしょうか。
I must disclaim something, dear colleagues. I was interviewed last week by NHK TV, so you might see that on Japanese TV in the future. They have a series of programs about risk factors and what you can do to improve your quality of life and your lifestyle. And because of the ADI report on risk reduction, they came to interview us.
Maybe today's NHK TV crew is coming, so maybe you're on TV maybe tomorrow or tonight. So that is very helpful for the reduce the stigma, I think.
ありがとうございます。他によろしいでしょうか。
Thank you very much. If not, thank you very much, Dr. Endo.
まあこれで8人の
With this, we have finished listening to 8 speakers today in session 4. And we need to summarize. We do need to conclude. But we would like to have a proper conclusion or a proper summary in tomorrow's session. I would like to touch upon that in tomorrow's session. Having said that, I would like to say that in any sense, whether it be promoting prevention or treatment, as well as education to build a society that is friendly to dementia. In pursuing these activities, education is crucial. No matter which stage we are in, no matter what kind of culture we have, the one common thing is that we need to work on training. I think we were able to conclude to that point.
I fully agree with the importance of training, and I think we have seen a lot of good examples, a variety of things that are happening around the world, and I'm very pleased to see that people are willing to learn from each other, and that creativity can be everywhere. It can be in a small town in Japan or in Thailand or in Germany, and we can all benefit by exchanging this information. And I think that's the role of the international organizations like World Health Organization of ADI to bring that together. So that's a takeaway for me personally, that we must put a lot of effort in the ADI website and in the Global Alliance that can help us with that.
ありがとうございました。
Thank you very much. We are a little bit earlier than the concluding time. We had scheduled to finish 10 minutes from now, but I would like to stop here. Thank you very much, all participants, for your cooperation.
May we also thank all the technical people in the room who helped us and made this work so smooth, and especially the translators. Without you, we could not have this conference. Thank you very much.
座長の先生
Chairpersons, speakers, doctors, professors, thank you all very much for participating. We would like to conclude the subspecial session with this. Thank you very much for being with us for a very long time. I would like to give out 4 housekeeping announcements. From 6 p.m., we have a government-hosted reception. For those who are invited, please move on to 51 floor 51, Roppongi Hills Club. And it is the same place as where we had lunch today. For tomorrow's main session, it will start from 9 a.m. in a different venue than today. It's called the Tower Hall, where we will have the main sessions from tomorrow. We will have booths and poster exhibitions as well. Also, from tomorrow, we have the ICT robot-related exhibitions as well, so please participate. Today, at the reception, if you have gone through the reception today, you do not have to go through the reception tomorrow. As long as you have this ID card, you will be able to enter smoothly tomorrow. So please do not forget this ID card tomorrow. Please just go directly into the venue and be seated in your sessions tomorrow. If you are not coming tomorrow, please take the card, but leave the name holder at the reception. Please return the card holder. Please make sure that you do not take out the translating devices out of the venue. Make sure that you keep the earphones on your seat as you leave this room. Thank you so very much for today. We look forward to seeing you tomorrow. Thank you very much.
Arigato. Okay. Yeah. So tomorrow we need to.